PIX5's Wilson Walker spoke to some experts who say the answer isn't that simple just yet. Wilson?
Ken, you got 6 million doses delayed by the storm. You have the Wall Street Journal talking about herd immunity by April. And you have concern that health officials are not being upbeat enough about the vaccine. There are a lot of headlines swirling around, some of them seemingly contradictory. What's going on?
Winter storm warnings aside, which has caused a huge amount of static in this system, there are a couple of things that are going on that are very much on the good side.
Among the good news, case numbers are plummeting across the country, including California.
You know, in certain parts of the state, you're really starting to see the dynamics of transmission change, and I think that's largely because of naturally acquired immunity.
But will that, along with early vaccination efforts, get us to nationwide herd immunity as soon as April, as some have suggested?
You know, I mean, I think that's highly unlikely.
We still need to do a lot of vaccinating, and that is going to require broad vaccine enthusiasm.
You know, it puts your mind at ease as to when you're going to get it and, you know, the nervousness of what's going to happen if I don't get it.
But not everyone feels that way. Some 33% of Americans are still skeptical.
The suggestion that health officials were too tepid in their endorsement of the vaccine, and perhaps had they been more gung-ho, more celebratory, it might have encouraged more enthusiasm amongst the population for getting a shot.
You know, you talk to enough people, you're going to get a mix of opinions. You're going to have some people who are more conservative, some people who are more gung-ho, as you say. And when you hear all these opinions, you know, people may kind of lose the forest for the trees. The forest is that this is the greatest miracle of modern molecular biology since the discovery of DNA. We all need to get behind this, and I would encourage everyone to get vaccinated as soon as their turn comes up.
Yeah, a question. You mentioned, a tepid response by some health. Who is actually saying that health officials have not been pushing this vaccine enough? That's all we've been talking about.
Yeah, well, look, it's been written up in the New York Times. It is the health officials who are concerned that there is not going to be enough demand for this vaccine to get us to the herd immunity thresholds that they would like to see. You know, if 33% of the population is worried about taking that vaccine, that potentially becomes problematic if you're trying to get enough of the population immunized. Thus the thinking, we've got to get people excited about doing it. So this is going to go on for a bit. Remember, we're still short vaccine, but when there's more of it, we're going to need a lot of people to want to take it.
Understand. All right. Wilson Walker taking a look at it tonight for us. Thank you, Wilson.